Welcome to Tooth Matters, where every tooth counts. I'm Dr. M, and today we're tackling a question I hear almost daily. Can tooth decay be reversed naturally? The short answer? Sometimes, but only if you catch it super early. Get ready to discover what works, what doesn't, and how you can actually give your enamel a second chance before it's too late. When we talk about reversing decay, we talk about the earliest stage, enamel demineralization, or what we call in dental terms as incipient caries. At this point, the enamel hasn't broken down completely. There's no cavity yet, just demineralization, or a loss of vital minerals. You might spot these as those telltale white, chalky spots near your gum line or on the tooth surface. This is your enamel waving a white flag, having lost some calcium and phosphate. It's a warning sign, but here's the good news. There's no hole, no pain, and no need for the dreaded drill, yet. To stop decay, you have to understand the battle being fought on your enamel surface. Think of it as a constant seesaw effect. Your enamel is the hardest substance in your body, made of amazing hydroxyapatite crystals. Decay starts when three main factors align: carbohydrates, the food, specific oral bacteria, the villains, and a susceptible tooth surface. When you eat carbs, those bacteria feast on them and produce acids. These acids drop the pH of your saliva, starting the demineralization process. This is the seesaw tilting down towards decay. But here's the amazing part. Your saliva naturally raises the pH back up, and your tooth starts remineralizing within 30 minutes. This seesaw between demineralization and remineralization happens all day long. To stop early decay, we just need to tip that seesaw towards remineralization by targeting the food and the bacteria. Since we're not removing our teeth, thank goodness, we target the fuel, in this case, the diet. Frequency is key. Every time you snack on sugar, the acid attack starts again. Reduce your snacking frequency. The sugar suspects. Not all sugars are equal. Sucrose, table sugar, is a top villain. Choose more fibrous, natural foods over sticky, refined ones. Fresh fruits over cakes and donuts. Watch the acids. Acidic foods like soda and citrus immediately drop your saliva pH, causing direct erosion. Limit their intake. Wait to brush. If you just had an acidic meal, wait 30 minutes before brushing. Brushing immediately can actually scrub the softened enamel away. The second target is the bacteria. The frontline defense? Your saliva. Saliva is nature's own defense mechanism, a mineral-rich buffer that neutralizes acids and delivers calcium and phosphate to your enamel. Keep it flowing. If your salivary flow is low, due to meds, stress, or certain conditions, you need to help it along. Stimulate and hydrate. Increase your water intake and choose sugar-free gum or use xylitol lozenges. These are fantastic saliva stimulants that help flush out bacteria and bring those minerals right where they need to be. Now for the clinically proven heavy hitters, the minerals that rebuild your tooth structure. Fluoride. It is the gold standard. Fluoride is still the most clinically proven agent for reversing early decay. It works by attracting calcium and phosphate ions and creating fluoroapatite, a stronger, more acid-resistant version of your enamel. Use it in your toothpaste, mouth rinses, or get professional varnishes from your dentist. It's a powerful preventive agent, but remember, it can only rebuild the surface. Once a cavity forms, fluoride can't fill the hole. Then there is the role of calcium phosphate products, which provide targeted repair. Beyond fluoride, we have calcium phosphate complexes, like the famous CPP-ACP found in products like tooth mousse. These deliver a huge punch of bioavailable minerals directly to the enamel surface. They are especially useful for teeth with those early white spot lesions, particularly when used in combination with fluorides. Let's clear up some misinformation out there and bust some myths about what doesn't work. Oil pulling. It might reduce some bacteria, but it will not rebuild or reverse enamel decay. Charcoal toothpaste. Often too abrasive and can actually worsen enamel loss over time as well as harm your gums. Be very cautious. DIY remedies, lemon juice, baking soda. These are usually harmful. If it sounds too good to be true, it probably is. Stick to the science-backed methods we just covered. Arsenic application on teeth or gums, this can cause severe damage to teeth and surrounding tissue, leading to necrosis of the tooth, gum, or bone. Here's the critical takeaway. Reversal only works before cavitation. Once decay breaks through the enamel, enters dentin, and forms a true cavity, it's no longer reversible. It's restorative, and you'll need a filling. Tooth decay doesn't happen overnight, and neither does reversal. But with the right knowledge, early action, and consistent habits, you absolutely can protect your enamel and avoid the drill. If you found this helpful, smash that like button and subscribe for more dentist-led insights. And remember, at Tooth Matters, every tooth counts. If you have a question about your white spots, drop it in the comments below.